Concern Worldwide Pakistan office, and today I will give an example of how we did and how we are doing M&E in emergencies, with the focus on a little bit about Concern. Concern has been operational in Pakistan since 2001, and since then it has been a strategic partner of BHA in Pakistan in responding to these disasters, starting from earthquake in Kashmir, then 2010 floods in KP, and now this, in the middle there were these IDPs problem, and now 2022 floods. So currently we are implementing about over 10 million US dollar worth projects of BHA in Pakistan, and it includes our flood response as well. So mostly these programs are on building disaster resilience. They are on building capacity of local communities as well as local government authorities, disaster management authorities, and Concern does most of its programming in the country through local implementing partners. So one of the components of building the capacity of local implementing partner is also funded by BHA. And when 2022 floods, since mid-July, when it started, nobody was prepared for it because monsoon is common in Pakistan in that season every year, and specifically for that part of the country which is normally drought affected. So Concern started its response with its own funds, and BHA was the first one who helped us in reaching out to those communities in Sindh and Balochistan. So I'm really thankful to them. If Manoj is somewhere here, and he could pass on thanks of all the communities, all the affected population who got benefited from them in a very short time. So it's a great thanks to Manoj, his team, and BHA for helping us in those times. So I will quickly start with the data that is coming from the disaster assessment of monsoon floods in 2022 in Pakistan. It is changing daily. Like today in the morning when I was looking, they declared 90 districts as calamity hit districts. And yesterday it was 85. So the numbers are still rising. More than 33 million population is affected. And initially when we started getting this information, we did secondary data review. That was from clusters, from working groups, from UN agencies, from the government reports, and then primary data is collected through our local partners in the field and our field office in Sindh through key informant interviews and observation. So the first thing was when this situation arose, we had to schedule things, like for any baseline. The most important thing, which I heard here, lots of people saying things about budget, that money is needed for M&E. Thankfully, in Concern, we did not face this problem till now, because all the cross-cutting areas are budgeted at the proposal stage, which include the accountability, inclusion, gender, safeguarding, all of those areas, comms, visibility. But for M&E, a separate budget is dedicated. We do not segregate it further, like this much is for baseline, this much for Endline, but and that is to give them freedom if they want to spend more in this area, or they want to do impact studies or in some more research work. So we do have a dedicated budget line for M&E activities. So scheduling baseline mostly depends upon the donor requirement. Like BHA, for normal programming, they ask it within first 90 days. So accordingly, we have to put in line the resources we need, the relevant tools we need, the community to target, and yes, whenever we work in field, we go through local enumerators, and it has a specific number of women as enumerators from the local community who understands their language and their culture. Like within the community, we pick the local enumerators, train them. So we have to look into the availability of all these kind of resources. And then in floods, like transportation was a big problem for us because the roads were flooded and the teams couldn't move. The bridges were taken away by flood water. So these are some of the things that we needed to consider when we started with these floods initial assessments and a baseline. And then all of our reports, either it's a baseline report, it's a PDM report, it's the quarterly, annual, semi-annual, all the reports must have to be approved by our M&E department and the reporting specialist, all the cell advisors team in the head office in Dublin before it goes to the donor. So that is also sometimes time taking with the feedback coming back and forth. So we have to look into all of these aspects when we are scheduling any M&E activity. The data collection techniques, Anisha went into detail about this. I won't go into that much detail, but considering the floods in Pakistan in this area, for normal programming, we have a lot of time, not a lot, but enough time to do it in more detailed survey, assessments, analysis. For floods, we started it with rapid need assessments by the review of secondary data and the direct observations, KIIs. So in order to get the information of the communities and affected population, just to know their rapid needs, their basic needs. So, and it depends upon the time and the depth of information we needed at that time. And now, when we are moving from a response towards early recovery, we are taking the data collection to a more detailed approach by contacting individuals, household surveys, focal group discussions. So in response phase, we were most reliant on the secondary data, direct observations, and because we were very short of time and we were to respond within a matter of not even days. The team has to be in the field to assist the communities the very next day, something like that. And we had to be in the office day and night. I still remember when it started in mid-July, August, September, I couldn't go home. I stayed in the office, though my distance between my home and office is just 3 kilometers. But there wasn't even time to leave anything. I would just take a break of 5 minutes, 10 minutes, come back, 5 minutes. And all of the team was there. We were in the office day and time. The rest of the team was mobilized in the field, our field office, their colleagues in the field office. They were also affected by floods, their families, their houses. So how could you expect someone to be in the office while his home is all flooded? So everybody had to be mobilized, and we were left with limited resources at that time because we had to mobilize with whatever we had. So that is somehow the background information. Next slide. The approaches that concern users and used, as I mentioned, we relied on secondary data and the rapid need assessment data. And then the other approach is to club it with regular programming activities, and these I will go into detail in a while. These we do it for response activities for less than 6 months projects. And then standalone baselines when the duration is more than 6 months and we are more focused on early recovery kind of activities. For the, as an example, when we were doing the WASH response in the community in Sindh and Balochistan, we did use secondary data and the assessment data through observations and KIIs, and there we found their problems of hygiene, especially for women. The children, the local communities, the hygiene practices were of least importance at that time, while they had lost their shelter, home, livelihood, and everything, and they were literally living on the roadsides without any shelter. Some didn't even have makeshift tents. So hygiene and WASH, that was of least importance to them. And then there was problem with like, for example, we took these two indicators, that person of households targeted by WASH program that are collecting water for drinking, like to know their drinking water needs and to know that they have functioning toilets, latrines, especially for women in those areas, for children, for adolescent girls. So for this, we did use secondary data and assessment data. Clubbing it with other activities, with the regular programming activities that are proposed, we did it for MPCA, providing multi-purpose cash assistance to the local communities, to the affected population. And as I mentioned yesterday, the selection criteria was very strict. We had to do lots and lots of questions in the form to establish a baseline as well. Besides prioritizing people with disabilities, women-headed households, child-headed households, elderly, pregnant and lactating women. So besides all those criteria, to take an inclusive approach, we had to look into their basic needs as well. Like, for example, from M&E perspective, I can easily say this household has lost 2 cows. But what does it mean for that family to lose its only source of livelihood for its family? Losing 2 cows on the paper, that's why I mentioned yesterday that we need not to compare qualitative and quantitative data anymore. They supplement each other. They explain each other, because if I say this household lost 2 rooms in their house, the flooding took 1 bucket of grain from the house, how will I explain it that it was the only bucket in his house? So there we clubbed it with regular programming activities, and this kind of approach was also for the response, which was for 2 to 3 months. And the other one is standalone baseline. When we are moving from response towards early recovery, the programs are between 6 months to 12 months duration, and here indicator need baseline is collected. Here we focus on the donor indicators and the sector. Which sectors are we focusing on, and the information is going to which donor. So as per those guidelines, here for BHA, as I mentioned, we have 90 days time. Here the information is more detailed, more thorough, more as per guidelines. Lots and lots of feedback is coming. We go till individual service, household service. So this we already did in a BHA funded BICR program, in which we are building community of the, building resilience of the community in Sindh. And unique part of being Sindh is half of the province is drought affected and they are struggling with drought. Half of the province is flood inundated and they are struggling with floods. So it is kind of having both at the same time. So challenges, Nisha talked about challenges in detail. I won't go into that much detail, but yeah, we experienced power outage, we experienced no internet, no cellular network. We had problems with taking on board the local enumerators because everybody was trying to save their lives, their families, move to a more safer place. The cultural perspective, time was of crucial importance. Accessibility, in some cases we had to take boats with fuel in gallons in the boat to reach the community. And that was not a lake or sea, that were just common fields, the fields where they used to grow their crops. Data quality, sometimes, yes, we get issue with the data quality when the data has to go from enumerator, pen paper, to the data entry operator, to the data analyst, and then to, so there are some challenges with those. The most, I would just like to highlight the consent form. When we ask the community to sign the consent form, they are innocent people, not much exposed to the outer world. They expect something. They say, okay, I signed the form, you took my photo, and I agreed to giving you my photo, now what will I get in return? Give me a kit or MPCA or something. Like, I need something, because this is normally the process for any kind of distribution. You get them signed on a paper. So that was something you must be thinking, how it looks there, because I said lots and lots of things. So a couple of photos for you guys. This was in Sindh. And next one. These are the communities. They just find a dry place and start living there with their families. Next slide, please. This is how it happened and how it looked. The local partners, concerned people, local community, everybody is like, maybe they are giving us something. They are giving us something. This was our field, and this was a school, used to be. This is the temporary shelter in a school. Any area they could find, they would move there. So this is how their makeshift tents are. And those are all the fields. It's not just a water body. This is a medical facility for the women, which also got flooded and everything is gone. They are living literally on the side of the main highway because there was only dry place. These are the beneficiaries of multi-purpose cash assistance from BHA. I don't know if I can see Manoj. Manoj is here. Manoj, I sent my appreciation to you, your team, if you could give it back to them from these people who, for whom BHA was generous enough to support them in this time when nobody could reach them. Next slide. So, thank you so much, and I thank Lloyd, Katie, Manoj, and Latif, who helped me compile all of this, and thanks to all of you for not sleeping on me. Thank you.